put this gallery view. Okay, so we're now next to each other and we are live on YouTube. Good morning, everyone. Pam Jacobson, your host of Three Things You Need to Know. And with me today is Dr. Ashley Curtis from the University of Missouri Sleep Center. We're now next to each other and we are live on YouTube. Good morning, everyone. Pam Jacobson, started, your host of Three Things You Need to Know. And with me today is Dr. Ashley Curtis from the University of Missouri Sleep Center. We're now next to each other and we are live on YouTube. Good morning, everyone. Pam Jacobson, started, your host of Three Things You Need to Know. And with me today is Dr. Ashley Curtis from the University of Missouri Sleep Center. We're now next to each other and we are live on YouTube. Good morning, everyone. Pam Jacobson, started, your host of Three Things You Need to Know. Okay, sorry about that. I'm getting a lot of feedback on my recording on the YouTube. Can you hear me, Ashley?
I can now, yes.
Okay, all right, super. Okay, so with me today is Dr. Ashley Curtis, as I said. And for those of you that are new, just joining, we are in week 12 of the resilience series that I've been doing really from the beginning of the whole pandemic, working with all of you to help you understand, first of all, the importance of you taking the responsibility to become more resilient, to become, to get yourself in a place where you're thinking about optimizing health. And one of the most important things you can do is sleep, which is why I've invited Dr. Curtis here today. But for those of you new joining, I encourage you to go back and look at the last 12 weeks that we've done, because I laid out the blueprint for you initially, and this past week I gave you the actual work now that we need to do in terms of optimizing sleep. And then we're going to hear today from Dr. Curtis about the science side of things. So without further ado, I'm going to read her bio because it's pretty impressive and I couldn't memorize all of this. And then I'll turn it over to her to talk to you a little bit about how she got interested, and then we will take your questions. So Dr. Ashley Curtis received her doctoral degree in psychology with a specialization in brain behavior and cognitive science from York University, in Toronto, Ontario, Canada. Her dissertation work focused on developing and evaluating strategies to improve cognition in younger and older adults. That would be me. She completed her postdoctoral fellowship at Sunnybrook Research Institute in Toronto, where she studied sex differences in the risk factors and outcomes of neurodegenerative disorders. She most recently completed a postdoctoral fellowship at the Mizou Sleep Research Lab in the Department of Psychiatry at the University of Missouri. Dr. Curtis is currently assistant professor in the departments of psychiatry and psychological services at University of Missouri, and the director and the principal investigator of the Cognition, Aging, Sleep, and Health Lab. Dr. Curtis's research focuses on bidirectional association between sleep and cognition in healthy and pathological aging populations. And her current research investigates how cognitive training paradigms impact sleep and cognition. She's also interested in the sex differences and other risk factors like pain and medications that we're taking and their impact on sleep and cognition across our lifespan. And she employs clinical, behavioral, and neuroscience methods to examine novel research questions in these areas. So I don't know about you, but I'm pretty blown away. That's really impressive. And I feel really blessed, Dr. Curtis, to have you with us today. And I'm really looking forward to hearing from you. I'm curious about how you got interested in, well, psychology to start with, and then how that became a particular interest in the area of sleep.
Yeah, I kind of always had an interest in science in general, but I was particularly interested in the mind and human behavior. So that kind of just naturally led me to do my undergraduate degree in psychology. And then after undergrad, I was lucky enough to get a position at a sleep disorder center. And I was literally one of those people that put the electrodes on the head and all of that and watched people sleep literally through cameras. But in doing that, I was able to look at sleep patterns throughout the night. I was involved in some pharmacological trials where we looked at different types of sleep medication and looked at outcomes such as mood and cognition, and of course, sleep patterns throughout the night. And I was really just fascinated by it. So in my graduate school, I studied mainly cognitive aging and ways to facilitate cognition in the short term. And then everything just kind of culminated when I did my postdocs, where I was able to kind of take my love of psychology and cognition and also sleep and kind of connect the two and look at the relationship between sleep and cognition. So it's definitely for me been kind of a lifelong passion, but I've been lucky enough to work with some great people and really, I think, start to uncover some really interesting findings regarding sleep and cognition. So I'm definitely happy to be here today and happy to answer questions and have a discussion.
Excellent, excellent. Okay. Well, I'm going to anticipate some of the questions that the group may have. And again, if you've got questions or out there watching and you have questions specifically for Dr. Curtis, you can post those in the chat area and we'll be happy to answer them. Or you can reach out to me after, and I'm happy to to help connect us back with Dr. Curtis to get your questions answered. But some of the things that I can anticipate, I'm curious. I know that a lot of folks out there, either historically or maybe even currently, are using medications for sleep, things like Ambien and so forth. Is there anything in the research that you're aware of about how those impact, I've heard that you don't necessarily get into the deeper levels of sleep. And so I'm wondering, how effective the sleep medications are at really giving us the restorative levels of sleep.
Mhm. Well, I think it depends on what type of medication you're talking about, but typically the research shows, generally on average in the short term, while these medications might be effective in helping sleep onset, so it might help you get to sleep a little bit quicker than you normally would if you weren't taking the medication. In the long term, there really aren't any benefits. And it definitely does not change your sleep architecture, which is what you were referring to, kind of your patterns of sleep and getting that deep sleep. So, the research definitely doesn't show any additional benefit. And like I said, it's more of I would say a Band-Aid approach. In the short term, it might work, but if it's something that's more chronic, you definitely want to look into more first-line behavioral therapies because that would allow for more long-term benefit to sleep.
Okay. And so I can anticipate the next question then would be, there's all different kinds of reasons and ways that people have issues with sleep, obviously falling asleep and staying asleep. So with, you said first line cognitive behavioral therapies, can you expand on that a little bit? Just kind of what your research shows as far as the various things you've studied that can help people outside of medications for sleep. I guess there's sleep architecture, the different levels of sleep and how much time you need in each one of those. In my world, that's important because of
Mhm.
when the repair and the restoration occurs.
Mhm.
But obviously, if one can't even get to sleep to begin with, that's a problem. So so I anticipate that the viewing audience is going to want to know what are some of the things that they could be doing to get to sleep, and
Mhm.
things that would impact that architecture as well.
Mhm. Well, I think so cognitive behavioral therapy for insomnia is the first line recommended treatment. It's really only in cases where maybe that doesn't work that you would go to medication, but really it's about developing better habits, not doing the things that would not be conducive to falling asleep and staying asleep. So things like exhibiting proper sleep hygiene, not napping during the day, avoiding alcohol and screen time, and you know exercises that are really stimulating at least 2 hours before bed. You want to kind of get yourself into that headspace and get your body ready for sleep. So that's definitely really important. And then people that have chronic insomnia, this is something that they've been dealing with for years. It's if it's acute, it doesn't bother them as much. But if it's been going on for years, it's something that they develop these behaviors. It's hard to kick them. So cognitive behavioral therapy will also look at your cognitions and see how you're reacting to your poor sleep and help you develop more adaptive cognitions, really. And as well as other things like relaxation and things like that. I think a lot of people don't necessarily set up their bedroom or do the activities in the bedroom that would be conducive to just sleeping. So a lot of people will watch TV, they'll be on their phones constantly, things like that. So it's really a combination of these behaviors and these cognitions that will really help you fall asleep and then also maintain your sleep throughout the night. So that's part of it. It's also about, we have a natural circadian rhythm, and if you do things to disrupt that, like substance use and napping and things like that, that can disrupt your whole cycle. So it will cause more problems falling asleep, and then you won't have that natural, kind of 7 hours of recommended sleep that's more consolidated, which is really important. So cognitive behavioral therapy is really just kind of recognizing those behaviors, providing alternative solutions and advice and recommendations, and then helping to really just change your behavior so that it can be maintained over time.
Okay. And cognitive behavioral therapy, that's a professional service that one would seek with typically a psychologist or therapist that specializes in cognitive behavioral therapy, correct?
Yeah, that's right. Mm-hmm.
Okay, good. So that's a great tool that is not something that I've discussed in my previous shows about the importance of sleep. So that's definitely something to consider. One question that I get a lot is, how much sleep do I actually need? And you just mentioned, 7 hours. Is there good data that says that there's a certain amount or time of sleep that we should have?
Yeah, so this varies across the lifespan. So when you're a teenager, the recommended amount is around 8 to 10 hours. As you get more into young adulthood and middle-aged adulthood, this is around 7 to 9 hours. And then as you get into older adulthood, which is defined as 65 and older, it's about 7 to 8 hours. So that's kind of the range that you want to hit. I would say 7 hours is probably the goal. There's a lot of research that suggests kind of oversleeping, like over 8 or 9 hours, or undersleeping less than maybe between 6 and 7 hours is associated with daytime problems. So 7 hours is probably the goal, I would say.
Okay. And, if one is in bed, asleep for 7 hours or so, how much in terms of sleep architecture, is there an accepted amount of time that one would need to be in those deeper levels of sleep?
So typically, your sleep cycle. So when you first start a sleep cycle, you have your lighter sleep, your stage 1 sleep, then you get into stage 2, which is still light, kind of getting into the deeper sleep. Stage 3 is your deep sleep, and then you go into REM sleep. So that whole cycle takes around 90 minutes. And most of your slow wave sleep actually occurs in the first half of the night. And then as you go throughout the night, it's more of the stage 2 and REM sleep, actually. So it's really important the first half of the night is critical to have feeling refreshed in the morning and getting that deeper sleep. And so if you think of it as 90 minutes, if you're sleeping 7 hours, you might have like 4 or 5, maybe 6 cycles of sleep. So it's important, like I said, to get into that slow wave sleep so you can experience the REM sleep and get through the whole cycle. But there isn't, it really varies throughout the night. It's just important to maintain your sleep so that you can get into those later stages.
Okay, good. And when someone, and I know just from my own personal experience, being 59, having gone through menopause, having had a change in hormone structure, that what became a problem for me was being able to stay asleep. So I would wake, frequently during the night. How does that impact that sleep architecture?
Yes, so that's very common during menopause. That's why, so typically women report more insomnia symptoms than men, but it really becomes extremely prevalent, that sex difference during menopause, because of the reasons that you said. So there are these hormonal changes that cause women to be typically more physiologically aroused throughout the day, so it's harder for them to fall asleep. But then throughout the night, these temperature changes and these hormone changes causes them to wake up more. So because waking up more, they're not getting those, going through the cycle and getting that more restorative, deeper sleep. So it's definitely, it's an issue, especially during that kind of critical menopause period. So definitely something that should be, investigated and treated during that time.
Right, right. Okay. Yeah, I mean, you know, obviously something that I, you know, am evaluating in my patients and have been able to solve with myself with appropriate, you know, hormone replacement.
Mhm.
It
Right.
definitely is an issue. So if you're out
Mhm.
there and you're a menopausal female and you're struggling with your sleep, understand that it's something, it's important to get that straightened out, and so that you aren't missing out on those important deeper levels of sleep.
Right.
Um, I do get this question fairly frequently. Many people have alcohol at night with their dinner, a couple glasses of wine. And so I frequently would get this question: should, you know, how much alcohol can I have? How close to bedtime? And I've heard, you know, varying stats and information about alcohol, and I completely understand that it disturbs the sleep in a very specific way. But is there
Mhm.
any, you know, rule of thumb or anything that you've seen in the science that would say, yeah, it's okay to have a glass of wine, or it's not and you should abstain,
Mhm.
or what's the best approach with alcohol and sleep?
So I think a lot, there's a lot of pop culture, kind of pop psychology recommendations for alcohol. You know, you see a lot about red wine benefits and champagne benefits for staving off cognitive decline and things like that. So there are some benefits to moderate alcohol consumption. For sleep, you definitely don't want to have any within 2 hours of bedtime. That's, you know, you're really kind of asking for your sleep to be disruptive if that's the case. And, you know, initially, if you do have alcohol within that, you know, 2 hour window, it can initially help you fall asleep, but the second half of your night is going to be more fragmented. And, you know, that's just a very consistent research finding. And then there's also some research that shows, you know, more, I would say more than moderate drinking can disrupt your sleep up to 2 nights later. So even if you don't see it that night that you had the alcohol, it can exert its effect up to 2 nights later.
Wow.
So it's definitely not something that, um, like I said, in moderation, it's probably okay. It's just that close to bedtime window can cause problems. And I
Okay.
think people, you know, because it helps them fall asleep, they think that it's more or less a sedative, but it really does not allow you to have that deep restorative sleep.
Okay. Okay, good. I had heard that, and but wasn't sure of the time window. So a couple of hours if you're going to have a glass of wine with dinner. But if you're going to go binge on the weekend, you could be paying for that a couple of days later, as far as.
Yeah, definitely.
All right, so that's good to know. Very good to know. And same thing with food. Is there? I know that certainly, you know, consuming food and beverage too close to bedtime can interfere with sleep. Is that
Mhm.
the same sort of time frame? You know, a couple of hours. Is that sort of?
Yeah, yeah, 2 to 3 hours for food, just because like the digestive system. But a lot of the sleep hygiene recommendations are always, you know, within 2 hours. I think some low density food before bed is okay, but again, you're just kind of, if you're putting your body into that state that says that it's not ready for sleep, it's not going to be sleep promoting. So that's really why you want to avoid heavy meals before bedtime.
Okay, good. And what is do you are you aware of any of the research around melatonin? That's something that I recommend frequently, and you know, I do make sure my patients are aware that it's a hormone, that you make it inside your body.
Yep.
Not everybody needs to be, you know, replacing that hormone, but I was curious to know from a science perspective what your thoughts were on melatonin use.
Yeah, so kind of what you just said, I think is important as a preface when you're discussing melatonin, because you know it is an endogenous hormone, so it's something that our body makes, and it's the levels start to rise about 2 hours prior to bedtime, and again, that's to get your body into this sleep promoting state. So some people will take the exogenous melatonin or the pills to kind of help supplement those rising levels um, if they're experiencing kind of a circadian disruption where they're not getting that natural rise in melatonin before bed. So yeah, so some people will take them about 2 hours before bed, and the research really suggests that it really only affects that sleep onset. So it might help you fall asleep a little bit quicker, but it really doesn't affect anything else. So even the sleep onset, it's you know small effects. It definitely isn't as large as more of a behavioral therapy. So, that's kind of my take on melatonin. It has some other side effects as well that are important, I think, for women and men as well, especially as they get older, because it's been linked to people that have hypertension. It's been linked to increased blood pressure and things like that. So definitely maybe a Band-Aid solution if it's something that needs to happen right away to get that increased or reduced sleep onset latency, but in the long term, not a solution.
Okay. And so so some of the solutions, last week on the program I had talked a little bit about sleep hygiene, but I thought hearing from you in terms of, especially because you're in a sleep lab and you're doing specific sleep research, some of the recommendations that you would have as far as maybe what a typical nighttime preparation routine might look like for the average person, just some of
Right.
things there.
Well, I think, it's important to know that we do have like our circadian rhythm, and it's something that's natural. So you want to do as much as you can not to disrupt that and to get yourself into a state that's ready, sleep promoting or ready to sleep. So, not napping during the day, having regular exercise, because that's important for good sleep. Participating in cognitively stimulating activities. I do some research on that suggests that it can also help sleep. And just, if you can't fall asleep at night, I think a lot of people, especially if they have chronic insomnia, will kind of lie there and ruminate about it and think about it. So another part of some of the behavioral therapy will be to get you out of the bed, do something non-stimulated, then go back to bed when you're sleepy. So you build up that association between the bed and sleep. And that's really important. And that's, something that's taken from behavioral psychology. Getting that stimulus association. So that's something that you can do, and it works. It's been tried and true. It definitely works. So those are some things. Some people, I think as well, if it's not insomnia, it could be sleep apnea. So I think it's really important, and that's where you stop breathing at night for a few seconds, or you wake up gasping for breath or coughing. Sometimes that can be guised as insomnia. People think that they have insomnia when actually they have sleep apnea, and that is very treatable through CPAP. So I think it's identifying your sleep problem and then, receiving the appropriate treatment.
Okay, thank you. So if someone is not sure, they just know that they don't wake up refreshed in the morning, and they perceive that they're, had wakeful periods during the night. What would is a sleep study? What can a sleep study tell us, right? If they came to a sleep lab and they had a sleep study done, what is that looking at, and what can that information tell us about our sleep situation?
So that can tell us a lot. It will tell you. So the thing that I just mentioned about sleep apnea, it will give you an idea of how many times you might experience that symptom. And if it's above a certain threshold, then you might have sleep apnea. And like I said, that's very treatable. If it turns out it isn't that, but you're awake for long periods of night, it might be insomnia. And then you could benefit from CBTI, that cognitive behavioral therapy for insomnia. If it's something else, there are lots of other sleep disorders that are less common, but they still occur. A full sleep study will also give you information on that. So some people, act out their dreams. Some people move their legs a lot at night. So they might need additional treatment. So the sleep study really gives you that full picture of your brain waves, your sleep architecture, your breathing, your body movements. So it really is kind of the gold standard for assessing sleep.
Okay. And I know that your research has been significantly focused on the direct link between sleep and cognition, and it, going both ways. The specific research that you've done, what have you found as far as that goes?
So some of the work that we've published recently, it talks about the association between sleep and cognition, but also how pain moderates that association. So people with more severe pain, they often show an increased association between sleep and cognition in kind of the way that you would expect. that increased pain can, it's more important for people with worse pain to get better sleep, because they're going to have, it almost exacerbates that association. They're going to have more problems with their cognitive functioning. So that's one of the things. Some things that I'm specifically interested in is kind of looking at it the other way. So not just looking at the effects of nighttime sleep on next day cognition, but potentially looking at your cognitive activity during the day and seeing how that impacts sleep. So I'm conducting some research on that now, and I hope to, hopefully get that out or publish that next year, in the next couple of years.
Okay. Fascinating. So looking at what we're thinking and what we're doing cognitively during the day, and how that might impact that, our ability to fall asleep, our sleep architecture, and so forth. Interesting.
That's right. Yeah. Mm-hmm.
Interesting. Oh, that's exciting. I can't wait to see that data. That'll be, we think about a nighttime routine for sleep, but and I often say, and I said last week, that a good night's sleep starts with what you did during the day.
Right.
But I've never spoken specifically about, other than, managing your stress response better, having proper fueling for the body, exercising, not napping, those kinds of things. But but I do, believe that what we think and how we feel and how we manage that, during the day is, has a big impact on what happens, to our sleep.
Definitely.
A question that I get, relatively frequently is, if I'm, a lot of times people have an issue with sleep just because they just don't have time, or they don't make time for sleep, right? They're busy and they work until late into the evening, or they have some adrenal dysregulation. They get a second wind at night and they can't get themselves to bed. So they end up with, maybe just getting a short amount of sleep, maybe 5 hours of sleep. A question that I will get oftentimes is, well, I do that during the week because I'm busy, but then on the weekend I will sleep, 12 hours and I make up for it.
Right.
Is it possible to do that? Does that really, can you kind of fill the bank back up with longer sleep?
So it was a study published a couple of years ago, and they showed that if it's around 4 to 5 hours, you actually can make that up on the weekend and restore some of the lost function or the dysfunction that you kind of experienced during the day. It's not a long-term solution, but there is some evidence to suggest that yes, you can.
Good.
If it's just within that, kind of an hour a night or something like that.
Right. Not like you can go all week without sleeping and then try to make it all up on the weekend.
Yeah, I mean, if you keep doing that, it's going to have more dire consequences.
So a temporary solution to a temporary problem, but not
a
solution to a chronic sort of abuse of the natural circadian rhythm for.
Yeah, but I mean, I think even these little things that you can do on the weekend, I think that's important for people to know, just because 1 or 2 nights of poor sleep isn't going to disrupt your life forever. That's something that can happen and it'll be okay. It's more of these chronic conditions. If it keeps happening over months and years, that's when you really need to think about looking into some of these other therapies.
Right. Okay, very good. Kind of the last question I have, or set of questions I have, is really more around sleep environment. That seems to be something that comes up quite a bit. Light in the room, temperature, pets or disturbances. Anything in the research that's clear about sleep environment? You could do a really good job of getting sleep hygiene and getting yourself ready for sleep, but what about what's important for us to know about the environment that we set up for sleep?
So temperature, definitely. I forget the actual range of recommended temperature, but that's something, it's recommended that you have your bedroom set at a certain level so that you can get yourself in that sleep promoting state. Not having I'm sure we're all guilty of this, but not having the TV in your bedroom, just because, people watch it before bed and the light from that can, be non-conducive to sleep. Your cell phones, there's a lot of blue light on the cell phones, maybe getting a blue light blocker or not using it, putting it out of the bedroom at night, which is, I know, difficult to do. The pets, I have a pet, and a lot of pet lovers like their pets in the bedroom. There's some research that shows that it's, improves mood and things like that. But of course, if your pet's up throughout the night, that's going to disrupt you. So I definitely think that would be a smart move potentially not to have them in there if you're having sleep problems. And then just if your partner snores and things like that, or if your partner has sleep apnea, definitely making sure that they get the treatment, because that can disrupt you throughout the night. So kind of things like that.
Okay, great, great. Yeah, I think, for me personally, I've come to recognize the importance of the environment. Dark, cold,
Mhm.
quiet makes, especially for, the menopausal females that are already too warm, it can be.
Right.
But I have a number of patients who it seems like their sleep issues really are around the fact that they've got an elderly pet that's up a lot during the night, or
Yeah.
they have a partner that snores. I know Matthew Walker, who's kind of well known right now for his book, Why We Sleep, talks about
Mhm.
sleep divorce, that some
Yeah.
people come to an agreement that they're not going to sleep in the same room because it disturbs the other
Definitely.
person's sleep. So just to wrap it up, Dr. Curtis, any other tidbits or ideas or things, tips, tricks that you might leave us with as far as having devoted your life's work at this point to the importance of sleep? Any final comments?
I think it's just important to monitor your sleep. Keep it, if you're having problems, keep maybe even a diary of your habits throughout the day, and then how you're sleeping throughout the night, because that can be really useful if you do go to see your physician, to discuss kind of your patterns, your daytime and nighttime patterns. And then if it's something that's chronic and you experience it for 3 months or longer, that's something that you definitely want to get checked out. There are lots of different treatments for the sleep disorders. It's just important to identify which one that you might have, and if it's something that is acute or chronic, and then developing a treatment plan, because most of them are very treatable. So that's there's a lot of hope, and it's something that you can improve your life by getting your sleep treated. So yeah.
Very good. Thank you so much, Dr. Curtis, for agreeing to be on the program. I hope all of you found this information useful. If you did not see last week's program, please refer back. I did give you a very specific to-do list of things that you can use to help yourself improve your sleep. And a lot of those are the things that Dr. Curtis talked about today. And there are many things that we can do in functional medicine to evaluate and help you improve your sleep habits, as well as resolve your sleep issues. So please do reach out if you have questions about how we can help you with that. So again, thank you so much, Dr. Curtis. Really
Thank you.
time. And I will certainly be in touch with you with questions from the viewing audience that come in after today. But I think we did a pretty good job of covering the subject. So,
Sure.
so I will sign off. We will talk to you all again next week. And thank you again, Dr. Curtis. I really appreciate your time today.
Thank you for having me.